Provider organizations need constant access to software, services, and data. When this is coupled with poorly secured systems, it creates consistent, easy, and prime targets for nefarious actors. It's these realities that drive the need for healthcare delivery organizations to improve processes and procedures, as well as their overall cyber posture, to ensure the protection of patient safety. However, as you know, improved security across the healthcare enterprise is not a straightforward path. Lots of hurdles face network defenders, from resources and knowledge gaps and staffing shortages to budget limitations across all departments, not just cybersecurity. So then, how do you know if you're doing enough with your cybersecurity program? What's going to happen when the inevitable attack comes? What will make you know that you are as ready as you can be? Well, the answer resoundingly comes in the form of the Health Industry Cybersecurity Practices, released by the Department of Health and Human Services. It's a 5-volume cyber resource tailored to the healthcare delivery organizations. It's broken down by entity size and type, as well as technical skill level within the organization. And it even includes guidance for those with minimal resources and experience in securing their infrastructure. HICP holds similar standards to NIST, but it's actually designed for healthcare environment. So you know the measures apply to your infrastructure and all its complexities, including medical devices. And it's written with the idea that there's no one-size-fits-all for any healthcare organization when it comes to cybersecurity. HHS recently updated the HICP to include the 10 cybersecurity practices identified by the 405D task group. This was done in an effort to support you with a starting point for your processes of prioritizing security measures. It includes details for workforce training and awareness, effective development and implementation of new security processes, and steps for securely acquiring and customizing new technology. By using the voluntary guidance of your network defenders can learn how to quickly adapt under the current and ever-changing threat landscape and ongoing evolution of attacks to build a robust response system to efficiently recover from attacks. The goal of the HICP is to foster a consistent, robust, and continually updated approach to cybersecurity. The framework supports healthcare network defenders with a better understanding of how to reliably evaluate and benchmark cybersecurity practices, know the importance of threat sharing and working with connected partners, and know how to prioritize actions and investments. HICP and leveraging outside security partners like First Health can support your healthcare team assess your current risk and leverage that information to prioritize needed security measures. But it may also help your organization avoid a steep monetary penalty from HHS in the event of a reported data breach. Public Law 1116-321, otherwise known as the Safe Harbor Law, requires HHS to take into account a healthcare organization's documented use of recognized security practices within the most recent 12 months of reported incident before they determine possible enforcement actions. That means by taking the steps outlined in the HICP or creating a plan to implement the measures, you can document that you've taken the needed steps to best defend the enterprise and were simply the victim of an inevitable attack. As our current customers, you already have access to service offerings that support an HICP alignment appraisal. Our HICP and NIST cybersecurity framework assessments determine your organization's ability to accelerate a prescriptive and targeted approach to the 5 biggest threats facing healthcare, as outlined by the 405D task group. First Health also provides shared leadership governance, digital strategy and support, cybersecurity portfolio management, risk assessment and management, as well as virtual CISO support to help you fill your staffing gaps. Working with a risk assurance team like First Health and other industry partners can provide you with external perspectives to give you insights towards making the biggest positive impacts on your enterprise. An HICP alignment appraisal will spotlight where the gaps are within your infrastructure and enterprise processes and provide a roadmap towards a more proactive and robust cyber posture. While it takes a family of firms to provide care in the healthcare ecosystem, the onus is on securing that onus belongs to the provider organization and no one else. Whether your security staff is limited or the board won't opt for a more favorable budget, you still must understand how and where to prioritize your limited staff and funds, where they should be deployed to respond to the most likely threats facing your organization. The voluntary guidance of HICP can reduce the risks facing your organization. If you don't know where to start, reach out to your first health professionals to see how we can help you better align with this invaluable resource.